Good morning, everyone. I'm John Simoes, and on behalf of Protect Our Care New Hampshire, welcome. It's good to have you here today. It's been a very busy news week for healthcare, and unfortunately, most of the news has been bad. Well, we started by scheduling this discussion because it's been a year since the passage of HR 1, the big, beautiful bill. And this week, I don't think the impacts could not have been more clear. The New Hampshire Affordable Care Act Marketplace is in a period of significant uncertainty. New national data show that approximately 5 million Americans dropped their ACA Marketplace coverage following the non-renewal by Congress of enhanced premium tax credits. At the same time, New Hampshire saw a decline in Marketplace enrollment, with thousands of residents dropping their coverage over a year ago, approximately 4.1%, as reported by NHPR. We also know that approximately 13,200 New Hampshire residents lost Medicaid and CHIP coverage. And nationally, putting all those numbers together between Medicaid and the ACA, 8 million Americans have now lost their health care coverage in the last year. And if that wasn't bad enough, the outlook became even more bleak this week with the announcement that Ambetter Health will exit New Hampshire's marketplace at the end of 2026, forcing almost 12,000 Granite Staters to look for new coverage in 2027. And again, having one fewer company in the marketplace here in the Granite State. So today we're going to discuss what all this means for patients, for medical facilities, for our economy, and what it can mean for the future of healthcare in New Hampshire. I've got two really good folks joining me today to shine some light on what's going on and to answer your questions. Kristen DeVideo is back with us. She's the founder and principal with Putney Consulting here in New England. And Ed Shanchala, who has been a wonderful guide throughout all this. Very grateful. He is the Chief Executive Officer of Ammonoosuc Community Health Services in the North Country. Both of you, welcome. I just want to open it up to the question I think we're all asking. This is a lot of bad news, a lot of numbers. Kristen, you want to go first and give us some guidance as to what does this mean? Where are we going? And how do you interpret all these bits of data coming together?
Yeah, thanks, Chime. There's so much happening at once, and it's net negative for everyone. There's access issue. There is the issue of people pulling out of a pool of people, and so cost goes up for everyone in the pool when there's less people in the pool. There are people delaying care, not getting access to care. And then there's a squeeze on our rural and in some urban centers of healthcare for people. And those are people that live and work in our state. And so it really is an impact on everyone that lives here.
Ed, obviously you're looking at the public health of folks, in northern New Hampshire. I'm sure seen this coming now, that this shouldn't come as a huge surprise. What do these numbers mean to people in rural areas? What does it mean? What do they mean for healthcare facilities in rural parts of our state?
Yeah, thanks, John. When we look at the North Country, you're looking at, I mean, for Ammonoosuc, we have 26 towns, there's 30,000 residents. So you get a sense of we have few people over many miles. It's challenging to do things effectively, efficiently, and sustainable in the best of worlds. So the investments we have historically, because of the ACA, has created stability for the healthcare system in rural and especially in northern New Hampshire. When we look at our critical access hospitals, 225 beds, and federally qualified health centers, community mental health centers, home health and hospices, margins are tight. If you're on the positive margin side, that's great. Oftentimes it's on a lesser margin. So when you look at the health insurance access, whether it's Medicare, there are a few opportunities in the managed care. We've seen people exit the market. When we look at Medicaid with the work requirement, that's going to be challenging. It's complex as it is. That'll add a layer of complexity. Some people won't be able to manage the complexity and they will become uninsured. And now with an insurance product commercially leaving the market, it gives people fewer choices at a higher cost. They're going to have to make hard decisions about food on my table, gas to get to my job, childcare, elder care, and maybe health insurance is not something. So that becomes a real significant challenge. So when they do need care, rather than coming and getting preventive care, and preventive care is $1 invested is $13 saved later. It's like changing the oil in your car. It's a smart thing to do because most of us don't have the money to replace an engine. And then if they show up in an emergency department for something that's preventable, $750 to $1,500 based on MEPS data. God forbid if you spend time at the ED and go, we really need to put you inpatient. In New Hampshire, is $2,000 a day on the acute care side, med surg, ICUs, 10 plus thousands of dollars. And if this is uninsured because of the Emergency Medical Treatment and Labor Act, hospitals have to accept us to come in regardless of whether I can pay or not. To Christine's point, that puts a economic burden on everybody else. And people may think, well, I'm not Medicaid or I didn't use Ambetter. Everybody's insurance is going to go up because these people need the care. It becomes uncompensated in systems that were already fragile. If we look nationally at critical access hospitals, they are fragile even before this happened. And this is going to increase their fragility. Having spent time in other marketplaces, having witnessed a 400-bed hospital during the Balanced Budget Act disappear, that's now a vacant lot, they do not come back. So now what do patients, where do they go? So this is, I can't see much good coming out of a market restriction, not investing in our friends, family, and neighbors by co-investing in the marketplace. So it's disconcerting on many levels, whether it's economic concerns, it's health concerns, and system concerns.
Thank you. And I'm going to go back to you, Kristen, and bridge off something that Ed said. Obviously, trillions of dollars were cut out of healthcare in HR 1 a year ago. We didn't see a huge drop in New Hampshire, only 4%, although obviously losing insured people is never good. I wonder who is dropping right now out of there. I mean, obviously, people with subsidies, we're going to assume people who can't afford healthcare. Would these be healthier people? Would these be people who might assume that they don't need healthcare coverage? And if so, from a public health perspective, what happens then to a health plan? And is that one of the things that Ambetter and others are putting through their mind as they're looking at the marketplace and they're calculating health insurance rates for next year for the people who remain behind? From a public health perspective, what do you see there?
Yeah, I mean, so New Hampshire is unique, but it's also, a microcosm of what we're going to see in rural areas across the nation. We have a lot of self-employed people that have their own businesses here in New Hampshire. And so for them, loss of subsidy or increased costs or having to pick a plan that maybe now has a higher premium, those are reasons that they're going to not be getting care or not having insurance whatsoever. And that makes up a lot of the people that live here in our state. And so once the pool gets smaller, the cost goes up for everyone. I mean, we know that insurance companies see that coming and they're going to pull out like Ambetter has. And when that starts to happen, just like Ed was saying, we're going to get more injured, sick people that are going to go in for care. It's just this squeeze. It's a squeeze on everybody. It puts a tax on the healthcare professionals in our state as well. We have, we still don't have enough primary care providers in rural health. We have behavioral health lack services. Still, there's not enough to go around. And so we're just going to see people getting more and more sick. And then some of those people may consider themselves healthy and not in need of care, and so opt out of the system as well. And then there's everyone else who lives in our state who are going to be getting services or coming in contact with other people that are potentially sick and not getting care. And it can create a complicated web of how we really are all interconnected and are going to start to lose out together financially, the economics for the state and in our health collectively.
So it sounds like this crisis that we're living in right now is one we could easily have seen coming. I'd like you both, if you don't mind, let's move forward over the next year. Is there anything we can do, and what should we be looking out for, given that we've got hospital consolidation going on, and we've heard recently from folks in Laconia and Rochester and other places that hospital consolidation doesn't always mean greater access and greater affordability. At the same time, we know the rural healthcare centers are struggling and that medical staff is also in short supply. We've heard about, longer and longer wait lines in emergency rooms in Concord, Manchester, Nashua. There's a lot going on. Fewer insured is obviously not going to help that situation, be it on the, Medicaid side, be it on the ACA side. So my question, that was a long one, is what do you see happening as we're going forward? Is there anything we can do now to kind of undo the damage that this HR1 massive cut has done to our state's healthcare infrastructure? And finally, what should we be looking out for? What other signs? What's the next shoe to drop? And I think we just dropped 4 this week. Sorry, it's a complex question, but if you Ed, you want to go first and give us what your prognosis is going forward over the next 8 months?
Yeah, it's when I look at we're starting to see the smoke on the horizon, right? So to the degree which we can demonstrate before things get too bad, before a facility starts to close. I mean, we had to close one of our care delivery sites a year ago in anticipation of what we're starting to see. So perhaps we were able to see some smoke sooner than other people were. And we were able to do that in a manner that didn't result in layoffs. And it creates some challenges that we were able to resolve for patients to get the care they need. You mentioned workforce. And when we think about workforce, we think about families, we think about younger workforce. And when people move here, they want to know a couple of things. Tell me about the schools. Where am I going to deliver my baby? And since I've been here in the best of possible times, we have seen 2 hospitals in the area who just couldn't do obstructed care anymore. They can't deliver babies anymore. So we have Littleton Regional and Androscoggin. In the event that either one of those were able to not be able to do babies anymore, how do I recruit younger people to provide care? To the broader society, how do you appeal younger people to work no matter what the business is?
Right.
That those are important economic drivers. For every dollar invested in healthcare writ large, it circulates through the economy 3 times. And when I look at a lot of small businesses, Christine pointed to it, the Affordable Care Act allowed them to stand up a small business, contribute to the economy, and afford health insurance. In the past, they might not have been able to afford it, or they didn't come and stand up a business and contribute to the economy because they couldn't. So you lose entrepreneurs when they're held hostage someplace they don't enjoy working because it's the only place they can get health insurance. So that becomes a challenge. When I look at what we're doing, this is long term. This is planting the tree, the shade of which I will never enjoy, is moving upstream where people live their lives with programs like Food as Medicine, a Cook Together community, or early childhood development. How do we help people learn and experience how to live healthier lives by working with them, not telling them how to live their life, because that never ends well. And it's pretty pejorative, and we shouldn't do that. When people have access to food, learn how to cook healthy foods, it's affordable. Their diabetes is easier to manage, in addition to the insulin that they may have to take. That's a long view. That takes months and years, and getting generations to have healthy food, fast, not bad fast food. So that's a culture change issue. We kind of don't have a lot of time for that. So it's hard to figure out outside of policymakers. We're limited to what we can do when we keep being disinvested. Every time we turn around, they're taking more money out of the healthcare system. And when you look at 360 million citizens, I see investing in healthcare as a matter of national and economic security. In the event that we have to defend our nation, you want people who are healthy doing that. In the event that you want to be first in the world economically, you need healthy people to do that. There's just no other way around it. It's a self-evident truth that healthy people make significant contributions locally and nationally. This becomes a policymaker's challenge, and it becomes a constituents to go, hold up, we have to stop this. We need to move to investing in our friends, family, neighbors, healthcare. So we'll see as time goes on. We have an election in the fall. I think this should be a significant piece of the conversation because we're just starting to see the front edge of the disinvesting.
Kristen, I'm going to ask you for the final word before we've got several journalists on who have questions. There's a Q&A feature, folks. If you want to ask a question of either of our guests, please feel free to type that in, and we'll be happy to ask them for you. Kristen, so long question. Repeat it quickly. What's on the horizon? What should we be looking for? What can we do? And where are signs of danger as we move forward with public health?
Well, I like that Ed is really talking big picture and built environment. And then, to your question, Jaime, what can we do right now too? We can help reduce barriers. There's an increase in barriers for people who are already struggling. They're under a lot of stress and pressure, and they don't have a lot of time. That impacts their health. And now there are increased trips that they need to take to X, Y, and Z, or things that some people consider small costs. If you're living paycheck to paycheck, they really have an impact. And then people have to make decisions about where they're spending their money. Do they fill up, heating oil, or do they go to their appointments that they need to go to and pay the copays for the medications they're on because they may already have a chronic condition or multiple, and it's not their fault, but they're trying to survive, right? And so we just need to work together to reduce barriers for people at that individual level too. So there's macro, and then there's the individual impact that one person can make for another person, and that falls on all of us, and even just people working in public health or in at the front desk helping people through a system. It's just too bad that it's happening right now, but hopefully we can move forward in a way that we can spread out some of the care for everyone.
I hope so. Yeah, it is tough because, bad political decisions often have bad consequences. It's taken a year, but as I said, it looks like this is the week that there are a lot of the signs of what's coming is starting to fall now. I'm going to ask my colleague Rachel to come back on and join us, see if we have any questions from the folks in the media who have joined us, who want our help in understanding what is, I don't want to say difficult to comprehend, but unpleasant to comprehend. Rachel, what do you see?
Thank you, Jaime, and thank you to everybody again for joining us. As Jaime said earlier, if anyone has any questions for our speakers today, please put those in the Q&A box at the bottom of your screen. If you have a question for a particular speaker, and you can put that in your question as well. Just to start off, we had a question submitted ahead of time by someone who could not make it today, and that is for Kristen. Could you talk about how a higher uninsured population will impact New Hampshire's economy and local economies, particularly in rural areas?
Well, those are two things that come together. One is people not having insurance or delaying care. And so they're going to be sicker when they come in for care. At the same time, because of the financial impacts, the health centers have to make decisions that reduce services and increase wait times potentially. And so now you have increased need, decreased service coming together in rural areas in particular. And that also impacts the people that live there that work in those areas too. There may be less jobs. It impacts the economy locally. I think that is the answer to that.
Thank you very much. And next we have a question for Ed. That is, what are your long-term public health concerns for Granite Staters as more hospitals and clinics close their doors and more of the population is uninsured?
Well, I think it's Christine pointed to a piece of it is that um, there's already distances to be traveled that can be a barrier. So if a hospital goes out of existence, you've increased distance to travel. You also look at timeliness of care. So as systems take on more bad debt, they're going to have to account for that somewhere, and that may mean delays in diagnosis and treatment. When we look at a lot of conditions, they don't wait, whether it's hypertension, it's diabetes, it's oncology. So I would expect to see an adverse economic impact on the healthcare system, increase waits and delays, and those waits and delays may result in increased mortality and morbidity, things that could have been prevented when we invest appropriately earlier. It's the things like colorectal cancer screening, breast and cervical cancer screening, early childhood interventions. Sadly, I know pre-Affordable Care Act of one instance where an individual first discovered that they had diabetes, thought they had flu and other things. This is a person who is married, has a family of two. The determination of diabetes was on the postmortem during the autopsy. That's not the time to find out. So there's a parent that's gone, there's an entrepreneur that's gone. These are things you can't undo for lack of appropriate investments in the health and wellness of our friends, family, and neighbors. I can't think of a better investment that is consistent with what our founding fathers envisioned for life, liberty, and the pursuit of happiness. Emphasis on life. If you don't have life, then the rest is kind of moot. They could have stopped right there if they had envisioned that we would have a society that doesn't invest appropriately into health and wellness from conception through how we leave the world. It should be high quality and dignified, and we should want to invest in our friends and family, neighbors' health and well-being.
Thank you very much, Ed. Those are all the questions we have for today, so I will turn it back to Jaime. But if any reporters on today's call have follow-up questions, I encourage you to reach out to him following our call. Thank you.
Well, thank you both. It's good to have you two here again. I appreciate this was a really good week to have this discussion. I'm hopeful that there's good news coming, but it's not good news as we look back on the last year since HR 1 passed and realize that it's as if the entire state of Wisconsin lost its health care, right? As if the 8 million residents of Wisconsin all one day to the next went without health care. Now that's the impact that we're facing. And obviously here in the Granite State, those kind of numbers, can't be good, but it's important to talk about it and to find ways forward and to find opportunities to correct, we'll say, the damage and make better decisions from a public health perspective. On that happy note, thank you both for being here. We'll keep an eye on the news cycle. We'll keep talking, and I truly appreciate your time and all the people who joined us. Just we'll hope for better news. Thank you.
Thanks, John.
Thank
Take care.
you.